Welcome to Working Smarter, Concise Compliance Conversations featuring Wendy Rubis, sponsored by Village MD, primary care physicians, practice medicine the way you've always wanted, data, resources, and clinical decision support to care for your patients inside and outside the exam room.
Hi, welcome to Working Smarter. I'm Wendy Rubis, General Counsel of Village MD. I'm here with Janessa Nelson. Janessa's our Legal Operations Manager. Janessa, how are you?
Good. I think that you forgot executive producer too.
Right. She's an executive producer of our podcast. Janessa, it's great to have you.
Thank you so much for having me. Wendy, you look a little tired. It looks like you've been running since November, December?
Yes. Thank you for that. I do feel tired because we've had a regulatory sprint really all year, but especially here in the end. At the end of this year, it's an end of an administration, as we all know. And so what we're seeing is lots of big changes just in before the buzzer, major regulatory shifts, and many of those came in just here at the end of the year. So yes, we've been sprinting to try to keep up with it.
Yeah. So I think maybe we should start off with what is the CMS Strategic Plan? I don't think a lot of people know that this exists. So
yeah, I think this is something unique under the former administration. They had this visual image of a strategic plan. One thing they did was they did a lot of work on branding initiatives, which was kind of a new thing for CMS. Frankly, it was kind of helpful it expressed their priorities. So it was patients over paperwork, price transparency. So a lot of the work, and one reason why I'm showing you this is a lot of the work that they did here at the end really was around things that they had valued as important. And so this was the strategic plan of CMS at the time. Now, this I think is actually taken down from their website already. So this is no longer available. And interestingly, in 2018, they actually announced, okay, we're going to do a sprint. They called it a sprint, regulatory sprint to coordinated care. And some of that just now came through.
So Wendy, the White House has already taken down that picture. What can we expect with this new administration? Should we assume things are changing?
It's a good question. It's something I've been thinking a lot about and trying to take the temperature of people that are closer to DC than I am. I like this website that I've linked down here because it lists out every promise that Biden made. So it gives you kind of a sense of where we expect to see change. As I go across the information we're going to provide today, a lot of this has a long arc. This is things that were not just started in the Trump administration. So most of the things that we're going to talk about today, we don't expect to change. Now, we did see an executive order from President Biden already that's basically asking each agency to evaluate whether to suspend some of these last minute changes. And so it's possible that we could see changes, but the areas that we expect that to take hold are going to be COVID-19 related policy, the Affordable Care Act, which is sort of, as they say, that's a whole other conversation, and drug pricing. The rest of this, I think, is going to hold.
Interesting. Okay. And just so everyone knows, in our show notes below, we'll have a link to the website that Wendy was talking about in case you're interested and want to look at it. I think it's really cool and interesting.
Yeah. It's basically all the promises and whether they were kept, nonpartisan. So, it does give you a reminder of kind of like what he promised to do. So it's a good guide.
Interesting. So let's just move on to talk about some of the changes that we're expecting to see and that we're preparing for.
Yeah. There was so many changes that we had to group them into buckets because we didn't want the podcast to be an hour long. And we're going to just touch on them. This is a 30-second drill down on each one. Some of these we're going to be featuring in separate podcasts because they're so important, but this is just a sprint. So buckle up because we're going to go quickly. First thing is many policies, if you watch Working Smarter or listen to Working Smarter, we talked about that the changes to Medicare from the very time it passed is trying to bring the cost down. And many of the policies are still around bringing down the cost of hospitalization, which still remains to be, over 30% of the total Medicare spend is hospitalization.
That's a lot.
It is a lot. And so a lot of these policies are about how to shed light on it. If you saw the strategic plan, there was a big philosophy of if you could arm consumers with information, but also how to bring the cost down. So first thing is hospital price transparency. And before you go snoozing, I know we've heard about price transparency for years as the be all end all, and we've had many different initiatives, price transparency. It's to the point where when I hear this, I don't even like perk up anymore because all of these changes in the past had a very low impact. Why? Because it didn't tell a particular consumer, it was all focused on the charge master. And so it didn't mean anything to you because your particular health plan had negotiated a discount. And so you didn't know what that meant for you. This is a major change. And we did a podcast about this earlier in this past or last year, actually, with Susan Zook. And I was pontificating this will never be enforced. This will never become law. There's no way this is even appropriate. And what the change is, and I turns out was wrong, what the change is that payer discounts are required to be disclosed.
That's huge. That's a crazy change.
So, and we'll go into the detail on our podcast, but just suffice it to say the real value here will be in data aggregation. So if a ProPublica or if some other, because this isn't centralized on CMS's website, every hospital has to publish their own. So the value will be if people aggregate, and then you can start to see to get this done at this hospital is going to cost me this much. To get it done over here is going to cost me this much. That would be a radical change. And so the American Hospital Association, no surprise, came out hot and they disputed this. And it was the appeal, final ruling on the appeal was December 29th. And I think many, many people watching this did not think they would lose that appeal, and they did. And so this was effective January 1st. Now, I've gone and looked at hospital websites and I haven't found any that are doing this yet. Some of them are like using wordsy words, but they're not really complying with it yet. So it'll be interesting to see, does this administration enforce this? Because there's supposed to be penalties if they don't. So we're going to go into this in more detail, but just know that's a huge change.
We've done a previous episode on HOPD with the change in payment for hospitals. I think that we saw an update because this was sort of in court decisions as well, right?
Right. So we do have a podcast we can link in the show notes what this change was about. It was challenged by the American Hospital Association, and it was, long story, it was held up in court, okay? And then there was some rigmarole and back and forth. Anyway, the decision was reversed in 2020. And so then there was some work that had to be done to straighten things out, put it that way. So this will now go into effect in July of 2021.
That's so soon.
If you remember, it was a step down. So it wasn't from 0 to hero, okay? It was step down. As of July 21, it's supposed to be totally level.
Wow.
So we have to watch and see what happens.
Yeah. And then last but not least, this is just a brief thing, inpatient only procedures. There's a change on that as well. Can you talk about that?
So this list was created in the year 2000, and it was a list of this can only be done in the hospital. And obviously, there's a concern about proliferation of ambulatory surgery centers mostly. These are mostly surgical procedures. And so there was a safety thing of on the ambulatory payment schedule. These will never have an ambulatory payment because it can only be done in hospitals. So that has been eroded over the years. They take things off as more and more surgeries are considered safe. Obviously, they're much less expensive in the outpatient setting. And so now they've actually just taken that list altogether off, that the list does not exist any longer. Doesn't mean that it's not to say every procedure can be done on the outpatient basis. There's a standard of care that professionals have to decide what is safe. But it just means that there isn't a payment rule that drives that. It's up to professionals to decide that. So I don't know. That's probably how it should be. It'd be interesting to see what the impact of that is.
Yeah, I completely agree with that. Yeah. And I don't think we'll be able to see that for a while, probably. Yeah. Okay, so let's move on to talk about physician payment. Obviously, this is a huge topic. Physicians care greatly about, are they going to be getting paid for services? What do they need to document? So let's just talk about some of these.
Well, the big story, obviously, for the year is telemedicine. And everybody knows that was approved on an emergency basis due to COVID. And so everybody wants to know, is that going to become permanent? And the answer is, we don't know. There's a lot of concern about fraud and that it would be easier to be fraudulent. And so we saw that in the takedown. There was a DOJ takedown in September There was a lot of unscrupulous practices in telemedicine. And so that's really going to be probably one of the drivers. The concern is going to be, can it be done safely and as efficacious as an in-person visit? One. And two, what are the controls for fraud? But along that same line, every year in the physician fee schedule, we see more and more codes that describe different modalities that can be done over the phone. We've talked about that in detail. We had new codes for new stuff podcast, if you remember, where there was just, these are not telemedicine for the whole visit, but different pieces of the service that can be done over the phone. And so that's extended a little bit every year. And so that happened. And we're going to do a podcast to focus just on those upcoming in this quarter. So that's the big takeaway. The other things are things probably people know. We've put a couple other podcasts out about the documentation. This was the Patients Over Paperwork initiative. This is a good change for us in primary care. I've had physicians for years tell me, if I document as required by the billing rule, this is not clinically significant documentation. It's just for the sake of the billing rule. So we don't ever want that. So this is a positive change, and we've got more detail that folks can tune into on that by some of our specialists and experts in our revenue cycle. Every year they update the quality reporting. One of the initiatives under the former administration was to condense and reduce and simplify the measures. And so we have an expert in our organization who is going to come and talk on the podcast about that in detail, but we've got some high level detail for you here on just the changes. So with the direct contracting entities, they're going to be looking at readmission and unplanned admissions, the star ratings. They've retired the rheumatoid arthritis change. They've returned the blood pressure measures, and they've got a new one for statin therapy for diabetes. So again, more detail coming out on that, but just an update. Everybody should know those change annually. And then the last thing was with the physician fee schedule really did lead to an overall reduction in payment. You can see more about this on Twitter, #StopTheCuts.
We should probably clarify, this is not Stop the Steal, right?
No, please don't type it in wrong. It's Stop the Cuts. But so there's a big push on that. Okay. And it did have an impact on primary care, but there was also a counterpoint, which is they are trying to increase payment for chronic disease management and things like that. So we have people in our finance department that are monitoring that and measuring the impact of that. But we're going to see adjustments to physician payments every year. It's just normal course. And this was the big headlines from this year.
Great. So let's talk about some of the other changes that we're expecting to see from CMS. I know one thing that we talk about all the time, it's a regulation that affects our sort of legal department, is start getting a kickback. We saw some changes happen at the end of last year. I mean, I've heard from you, they're kind of meh. Can you explain what's happening and what we're expecting to see?
Yes. So we saw a proposed rule sometime back, and that's the way this goes. There's a proposed rule, and then it was finalized just now, December 2020. And the main thing to know is you may have seen headlines like this is going to be amazing, major change. It really wasn't a huge change for most people. And there were some inside baseball changes to definitions. It's hard to say if those would have a huge impact. But the main thing is it wasn't a huge change. And this is an area that we do understand the executive order is going to apply to. So we're going to probably see this be put on hold and reevaluated with the new administration. So more to come on that. Another area that we've talked about that is a focus is patient access to info. So hopefully everyone heard about our info blocking podcast. That's a major change that's going to affect physicians, patients, and it's going to open up patient info. Similar along the same line, we saw a proposed rule focusing on patient access. The new administration will evaluate that, so we don't have anything final to report, but physicians and their staff should be checking your patient access processes and making sure that patients can get their information inside of and in compliance with the rules, and that you're not putting up barriers and blocks to that. So that's another area of focus.
Obviously, there's going to be a lot of changes with the Affordable Care Act. So we'll probably be doing whole episodes just talking about the Biden changes to the Affordable Care Act that we're expecting.
The Affordable Care Act is the thing that ends up on your evening news.
Yeah.
And so what we're going to do is, the major changes there have to do with the Medicaid plans, number one, the exchanges and the access and communication about them, and the mandate. So we're going to do a whole separate podcast. It's time everybody should take a minute and refresh their memory. What is the Affordable Care Act? What did it originally do? What has been scaled back under the Trump administration? And that's going to help us see where we're going to see changes. And already, I mean, even since we've started drafting this podcast, we've already seen executive orders come through and some major changes already starting there. So we'll do a separate podcast on that. The last thing that I think is just worth mentioning in the year of COVID is what has happened in the skilled nursing. It's kind of a juicy story, Janessa, actually, to tell you the truth. It's a little bit of a juicy story.
Love juicy stories.
Yeah. So what happened here is the Obama administration did an administration sprint, just like the Trump administration did. And one of the last things they put through was a revamp of the conditions of participation for nursing homes. Those are huge, okay? Hundreds of pages. And they really matter because nursing homes get surveyed on those all the time. And so it's basically an operating manual of the requirements for a nursing home. Huge change. And it had not been done comprehensively like that in many, many years. So the industry, immediately after Trump became president, started lobbying for a scale back of that. And so the Trump administration scaled back some of those requirements early into the administration. And one of them was infection control. And so they said, for example, the change there was you don't have to have an infection control practitioner in the building, which infection control practitioners usually do observational work. And so that is a relatively controversial statement that they don't have to be in the building, okay? Just an example. So shortly after that, and this is sort of sad, then the COVID-19 hit nursing homes. And so here the administration they had just taken out infection control and other requirements. And then we had this terrible once in 100-year event. And so they responded by penalizing the nursing homes and putting major fines on them, which kind of ran up against the idea that they had just loosened the rules.
Wow.
So basically, when COVID hit, it looked like they made a mistake. They dropped the ball. They just made this possible. And so then they were defensive and trying to, look like they had it under control. There was a big 60 Minutes on this. And during this, and Seema Verna, who was the administrator of CMS, didn't want to be interviewed, but she was live tweeting. So anyway, that's the salacious part. So at the end of this administration, they've brought some of the rigor back into those. We're going to see more changes there. The other thing that everybody should know about skilled nursing, and this is important, is there's been a new case mix system, a brand new system for payment. If you know anything about nursing homes, over the years, they had these RUG payments, which are acuity-based payments. And the way you get more money is you do more physical therapy. So what's happened is there's a feeling that they're overdoing the physical therapy more and more and more minutes is a way to get paid more. And so this new case mix system de-emphasizes that physical therapy, and it really is focused more on chronic and serious conditions, feeding tubes, breathing tubes, things like that are really needed because of the compression and shortening of hospital stays, where they want nursing homes to be able to care for these more complex patients. So that's also been going on in the milieu. People should know about that change.
Yeah. And we probably won't see how that change affects skilled nursing homes for a while, probably.
Yeah.
Yeah. Okay. So last but not least, we're talking a lot about CMS, but I mean, that's only one small portion of the federal government and the agencies that the Health and Human Services oversees.
So much more. We have hundreds of things, whether it's OSHA, CDC, FDA, and it goes on. You can see here a picture that was done by the American Hospital Association of agencies and divisions that regulate healthcare. And so there's a lot to talk about. So Janessa, thanks for joining.
Thanks for having me.
It's always a great time to be at Village MD.
It really is. There's a lot of changes coming down the pipeline.
Almost every change is great for Village MD.
Because they're impacting primary care, and that's where our organization is. We're excited about all the content that we're going to be putting out in our catalog for this next year. We're really excited about some of the guests that we have that are coming in. Some of them are very special and exciting. So we hope that you stay tuned and join us for additional episodes so we can cover and fill you guys in with all of this information. And Wendy, I should, remind any of our listeners, if you want to take something away with you to remind you of the points that we talked about, we always have these key takeaways available. A link is in our show notes, and you can go download these and take them with you.
Great. Thank you, Janessa. And I'm looking forward to a great year.
Yeah, me too.
Thank you to our sponsor, VillageMD. We hope you will join us for future concise compliance conversations.